So now it's my privilege and pleasure to introduce Don Winstead, our keynote speaker for today. Don is the principal and founder of Don Winstead Consulting, LLC. He has over 30 years of experience in state and federal service. He began as a frontline caseworker. He then served as Deputy Secretary of the Florida Department of Children and Families, Special Advisor to the Governor for implementation of the American Recovery and Reinvestment Act, and Deputy Assistant Secretary for Human Services Policy at the U.S. Department of Health and Human Services. Don is going to give a keynote on balancing local flexibility and accountability while targeting benefits to intended recipients. And this is really something.
Given the emergence of issues like the separate state-funded programs and the applicability of TANF regulations to those separate state programs. So the regulations were published, and so the games began. I think of 1996 to 1999 as the golden age of TANF. The spigots of innovation were wide open. The regulations then that began to constrain that flexibility also began to constrain that innovation. Now, the regulations were not bad, but they did, at least as perceived by the states at the time, begin that process of constraint. Some states responded by expanding state-funded programs or using other methods to either retain flexibility or avoid potential penalty. Some, particularly folks here in D.C., saw these actions as mechanisms to avoid accountability and to permit the weakening of the emphasis on work. Later actions, like the Deficit Reduction Act of 2005, sought to further impose requirements to improve accountability. Some states responded with even more creative processes like token payments to improve participation and avoid penalty. Over time, innovation seemed to wane, and my observation is the TANF work participation rate became like the old AFDC error rate. Now, for those of you who are too young to remember AFDC and the AFDC error rate, in AFDC, there used to be financial penalties on states if payment error rates exceeded certain thresholds, sort of like SNAP is today, but worse. States would go to great lengths to avoid these penalties, and today, my sense is that manipulation of work participation to avoid penalty has, at least in some places, taken on that same prominence. Meeting statutory requirements and avoiding penalties is not a bad thing to do, but the energy committed to the advanced mathematics of penalty avoidance can be a drag on innovation. Some lessons learned. In late 2010, the last time so far that I retired from state government, I was asked to talk with some of our agency's leaders about what I had learned in over 3 decades of government service. I wanted to be profound, but the key lessons I could think of were really quite simple. I was reminded of those lessons when I reflected on the topics on today's agenda for the upcoming panels. These observations are certainly not original with me, but I think they bear repeating today. I blanked the screen on purpose. Okay. Yeah. I was done. I was done with it. So, no. Okay. So, I love technology. I really do. So, to the simple lessons. And these observations are certainly not original with me, but I think they may bear repeating today. The first key thing that I learned was taken from a growth management report that was published in Florida in the mid-'80s. I was reading the report and turned the page, and bracketed on one of the pages was a statement like the following. For many people, the most effective human services program is a job. Okay? For many people, the most effective human services program is a job. Work is good. Not only does it provide income, but it gives us something to do and in many ways defines who we are. Most low-income people that we're trying to serve in our safety net programs want to work. In 1994, in Florida, we implemented a pre-TANF welfare reform demonstration program called the Family Transition Program, or FTP. FTP combined strong time limits, strong work requirements, and robust support services. The program was evaluated by MDRC, and as part of the evaluation, all of the participants, both in the treatment and control groups, were administered a background information form, or BIF, and also a private opinion survey. Not surprisingly, the results of the survey indicated that these recipients had a strong work ethic. Most recipients had worked in the past, and most wanted to work in the future. However, when we asked people how many jobs they had applied for in the past 30 days, the results were less positive. Most people valued work, but had not necessarily acted on those values. Some people needed help with transportation or child care. Others had other reasons. Some were simply discouraged. But the bottom line was that the actions associated with work were not always evident. When I left ASPE in 2005 and returned to Florida, I met with the key leaders of Florida's workforce programs who administer the TANF work requirements. My message to them was simple, straightforward, and not necessarily coordinated at the time with Steve Wagner, but my message was, don't worry about the participation rate, worry about engagement. Engage everyone, and the participation rate will take care of itself. This is why I'm encouraged around about the conversation that I hear about TANF reauthorization, which really, TANF reauthorization is sort of like the abominable snowman. You hear a lot of rumors of it, but it's hard to actually find it. But at least in the conversations about increasing the focus on outcome and engagement rather than solely relying on what's become the arcane calculation of work participation. I think that's a good thing, a good move in that direction. A second lesson that I learned is more related to child welfare, but as we discussed promoting strong families and family economic stability, it's something to keep in mind. The first time I ever went out on with a child protective services worker on a call, we'd received a report of possible child abuse. The allegation was bizarre punishment. A 14-year-old girl had skipped school, and her father decided to punish her by cutting off all of her hair. We had a little background information on the father. He had been diagnosed at some point with paranoid schizophrenia. He had a history of abusing alcohol, and he collected guns. We decided to ask law enforcement to respond with us. They sent 2 squad cars and a sergeant, and when we drove up, the dad opened the door, looked out, and then shut the door. The sergeant said, "I hate it when they do that." We walked up to the door, of course, the protective investigator and I standing in front, and the police officers with their bulletproof vests standing safely behind us. After a several-hour standoff, we finally had to get a warrant and were able to gain entry into the home. Ultimately, the dad was arrested for shoving a police officer, and we took the young girl to an emergency shelter for her safety. I went home feeling good about how things had worked out. The next morning, the protective investigator called me to let me know that the mom had posted bail for the dad and the girl had run away from the shelter. Any guess where she went? Yes, home. The protective investigator made an observation that turned out to be a powerful truth. She said, "You can remove a child from their home, but you can't remove a child from their family. Okay? Families are sticky, even families that are far from ideal. So often when we ask young people who are former foster children what we could have done better to help them, they say, "You could have helped my mom be a better parent, so I would not have had to come into foster care." In the 1970s, a family therapist named Virginia Satir wrote a book called People Making. One of her observations was that families are the gardens that grow people. As we contemplate issues related to family economic stability, strong social relationships, including marriage and intergenerational economic mobility, we must confront the fact that families are becoming more complex and that the support structure for families is becoming more fragile for many. I've spent a lot of time in the past several years working with states, counties, and tribes on child welfare issues, particularly around child welfare financing. There's an increasing recognition that providing services to families to prevent the trauma of removal is preferable when this can be done without compromising safety. Also, that kinship caregivers have an important role to play in situations where a child cannot safely remain at home. Earlier this year, Congress passed the Family First Prevention Services Act, and the promise of new tools to help strengthen families and caregivers are contained in that legislation. At the same time, when I've had a chance to interact with folks in the TANF community, I hear a concern that we should build in new requirements to restrict TANF expenditures on child welfare in order to focus expenditures on work, training, and work supports. I'm for work. I'm for training, and I'm for work supports. But my hope is that we will proceed carefully down that path. TANF plays an important role in supporting relatives who are caring for children both within and outside of the child welfare program. The promise of the Family First Act will take some time and perhaps even some statutory tweaks to fully realize the goal of providing more effective help for kin. The intersection of TANF and child welfare is a critical part of building programs that support families and prevent unnecessary entries into foster care. A third observation I want to make relates to accountability. It's a quote from the former head of Scandinavian Airlines. "People without information cannot take responsibility. People with information cannot help but take responsibility." To me, this is a key concept in accountability. If the outcome or desired result is clear and the data showing performance towards that result is available and transparent, then performance will improve. So from those observations, I offer the following. To my friends here in D.C., both those that propose legislation and those on the Hill that draft legislation, try to focus on the what rather than the how. Clear goals and clear outcomes are the key. Define the key results to be achieved and let the states and local jurisdictions focus on how to achieve those goals. To my friends in the states and counties and tribes, reporting requirements are your friend. Make yourself accountable for results and show your progress towards these results. To both, transparency is here. Embrace it. Not only in summary reports, but where possible in detailed data sets and microdata. Another key element of transparency is not only making data available, but timely. When I was at ASPE, one of my goals was to stay long enough so that I could see program data that reflected a time that I was there. Okay? At the state, I was used to seeing data about what happened last week or last month. There have been times when it took almost 3 years to post performance data and caseload and financial data in the TANF program. Now, kudos to OFA that's the Office of Financial Assistance, for posting the 2017 participation data the quickest that it's been posted in recent history. So that's a good step forward. I know the problem when you talk to folks at OFA with posting data more rapidly is that quite often states are tardy in submitting their information. I have a radical idea. Why not post who has submitted the data and when? I guarantee data will come in faster. And speaking of data, I'm so pleased to see that that IRP, the Center for Poverty Research, and the NAWRS logo are all on the same agenda. The potential for collaboration between the academic community and practitioners is enormous. States have more data available than they could ever analyze, and if we can combine the analytical capacity of the academic research community with the practical information needs of states, counties, and tribes, everyone will gain. Finally, it's important to align funding mechanisms with program goals. Reward success, both implicitly and explicitly, but avoid big bonuses and penalties. It's hard to build good programs with non-recurring and unpredictable funds. Penalties can send important signals, but reducing resources does little to spur program improvement. When I was a frontline supervisor, I thought the real problem was with the program was that the people in the district office just didn't get it. Then I was promoted to the district office, and I found that the people there did get it. So I suspected that the real problem was those people in the state office. Then I went to the state office. Again, I found it wasn't the source of the problem, so it must be the feds. Then I became a Fed, and I found that the people at ASBE and the people elsewhere in HHS were some of the brightest and most capable professionals I'd ever worked with. I had to conclude that at every level of government and many places outside of government, good people are working hard every day to make these programs work. If we can remember that we are all in this together, we can get the right balance of flexibility and accountability so that the people who access our programs can get the help they need to move towards self-sufficiency, and the people who oversee the expenditure of these public funds can see that the investment is being well made. Local flexibility and accountability do not have to be conflicting concepts. We can have both, and the families we serve will benefit. Thank you.